Are you tired of being told to walk up straight with your shoulders back? Or maybe you've got that annoying pain in the upper back, neck and shoulder that just doesn't want to go away. Well, in today's video, we're going to address what we call hyper-kyphosis. And welcome, my name is Marius Visser. I'm a biokineticist. I manage the Exercise Medicine Center at the Oncology Unit. And today's video, I'm going to show you one specific exercise with 3 component exercises built into it to help you with your condition. So the exercise we're going to do today is the wall slide. It's a very simple and basic exercise, but it can be quite challenging. And in my opinion, it's one of the best exercises to not only get rid of your posture and that curvature you got in your spine, but also alleviate a lot of the tension and pain that you might be carrying in the upper back and neck area. Now, before we get into the wall slide, there are 3 more additional components that I want to bring in. It's very important that we do these 3 components first because you might have a very difficult time doing the wall slide, which I will show you a modification of the wall slide. So let's start with the first component, and that's a very simple component. We're just going to stand where we are. Now, I want you to place your hands on your chest for me, and then I want you to feel, if you're already one of those people that are in that kyphotic posture, especially like I said, as we get older, we start curving forward, our gaze, our stare starts moving down towards the floor, and instead of picking up the chest, we actually just lift our chins up. And now we're walking with our heads up like this, placing a lot of undue stress at the back of the neck. So the first thing I want us to do is place our hands on our chest, and then I want you to just feel, if you can sense that your hands are behind you, your eye line, say your nose to the ground. If your hands are behind you, that is already an incorrect posture. So what you want to do is I want you to feel that you are pushing your chest up towards the ceiling with your hands on top of your chest. Now, one thing that you will notice, as soon as you start lifting your chest up, something down at the bottom here, your pelvis, is going to shift as well. You're going to go from a posterior pelvic tilt where your pelvis was tucked in under your body. Your bum is going to feel like you're sticking out your bum behind you, and you're going to start developing a little bit of a curvature, a little bit of a hollow back. So what you want to do is you want to repeat that. I want you to pick up the chest. Feel now, if you stop in that position, you can feel, does your chest feel like it's more either underneath you, or it might in some cases just be a little bit in front of your chin. And that is the position that you want to maintain. And then from there we relax again, and I want you to breathe out. And again, when you come up, push the chest forward. And I don't know if you'll notice that your shoulders are going to drop down and back. And I want you to focus on getting a little bit of a squeeze or a contraction between the shoulder blades in the back. And then I want you to relax again and repeat it one more time. Breathe out, get your shoulders down and back, push that chest forward and back, and feel what sensations you're feeling in your body right now. Do you feel the muscles contracting at the back? Those type of sensations. Do you feel something pulling? How's the neck feel? And relax. Okay. Now, one more time, I want you to bring it up, and I want you to hold it there, and I want you to drop your arms down for me. And I want you to feel what sensation that is. Whether your chin has now come down and your head is actually sitting on top of your body instead of being in front, because that can really affect your balance, especially when you're walking around and when you're doing functional things at home. So when you're standing up straight, your chin is going to come down and it's going to feel like your head is shifting on top of your body. That is the first one. Just a sensation exercise, and also it's just to get that motor control or neuromuscular readiness for what's about to come. Now, for our next component, you need to be able to get either down onto the ground or find yourself a nice firm surface. It could be doing it on your bed as well, but I don't recommend it doing on the bed because the bed might give away a little bit of the firmness, and then we might lose out a little bit of the extension component of this drill. But nevertheless, if you can't get down onto the floor, second best is going to be a firm surface like a hard bed or a mattress. So what we need is, if we don't have any one of these, this will be our top first choice. It's just an extension pad that we use for our lower back and upper back patients. It gives you a little bit more firmness for your upper back. But if you don't have that, it's not a problem. You can use a small rolled up towel, and you can decide how hard and how big you want to roll this towel, because for the first time you might feel it could be a little bit more uncomfortable the bigger and the more firmer the towel is. But After you've done it a few times, you'll start feeling a little bit of a relief. Everything is going to start opening up. The spine is going to start becoming a little bit more flexible. And even muscles on the front, on the anterior side, your ab muscles are going to feel like they're stretching out a bit. And this towel is going to be placed in between my shoulder blades that line across my back on the apex of that curvature. So we're going to get into our position. So we are placing the towel at the bottom part of the shoulder blades, but you can play around. It can be a little bit higher or even a little bit lower, depending on how comfortable it is. Then we place our hands behind our heads, and I want you to take a deep breath in, and as you breathe out, I want you to start extending back. You don't have to go all the way to the mat yet, because if you haven't done this before, your body is going to have a fear of movement response. It's going to try and stop you. Things are going to feel a little bit painful, things are going to feel a little bit tight, and I want you to breathe and relax through this. It's important not to force yourself. So what we're going to do is, again, hands behind the head, very important, because you don't want your neck to do this. I don't want you to push yourself towards the floor using your neck muscles. I want you to think about what we did when we lifted up our chest when we were standing. I want you to think that you're doing that. You are lifting up the chest again, breathing out, and then coming back up again. And again, we go again, breathe out, as far as you can go safely, and come back up again. Now you might feel every time you go, you get a little bit further and further and further. Eventually you will be able to get towards the floor. Once you can get to the floor, you can relax in that position. Because once we're in that position, then you can start working on your breathing on its own. You can focus breathing in, and then as you breathe out, I also want you to think about bringing this rib cage down. Because another thing we want to do is we want to open up the spaces in between the rib cage, because when you're in that hyper-kyphotic posture, you are actually compressing your ribs, and that can actually restrict your breathing. Your lungs cannot inflate to their full size, which has a knock-on effect on your respiratory system. So we want to try and get your ribs to flare out open like that as well. Instead of all moving as one, I want you to focus on breathing, and as you breathe out, you are pressing this rib cage and it's moving down. So we open up everything. And we just do this another 10 times. And on the 10th one, you try and hold it in that position for 10 seconds if you can get to the floor. Otherwise, you can just do the 10 as best you can. And then we move on to the next drill. And the next or third component we're going to do now is we're going to loosen up that thoracic spine. Also, it's going to loosen up the chest, it's going to loosen up the lower back, it's going to loosen up a lot of other structures in the body. So again, I use this wall slide exercise plus these three components on a daily basis with 99% of my patients, because like I said, the patients that come to me or my clients that come to me are all over the age of 50. They all have movement disorders, they have breathing disorders, they have painful disorders, and some of them are former cancer patients and current cancer patients. So I use this with all of them. So I'm getting great results, not only with their breathing, but also pain management and better movement and posture. Now let's move on to the third one. Next component, we are going to lie on our sides. Again, you can use a bed. You're going to bring your legs up into a 90 degree position. In other words, there's a 90-degree bend at the knees and there's a 90-degree bend at the hip. And then you can place your bottom hand on top of your legs, because that's going to stop you from, when you're doing the movement, I don't want your legs to move or your pelvis to move. And all we're going to do is we're going to, again, start with a deep breath with your hands stretched out in the front. And as you're starting to rotate towards the back, you're going to breathe out. Make sure the head is, you can use a pillow if you want. You can keep a normal sleeping pillow under your head as well, if that's going to help a bit. Breathe out, 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 and see if you can place the opposite shoulder. This shoulder needs to touch the ground before the arm. So you're going to go first with the shoulder, get your shoulder blade as close to the ground as possible, and then follow through with your arm. So you're going to feel a nice stretch across the chest, all the way down the arm, right down to the bottom. If you cannot touch, that's okay. Come back, breathe in, and as you breathe out, you try and relax through the entire range of motion. If you can only come up to there, I don't want you to force the shoulder so that it pops out at the top here and you get this little bit of a chicken wing coming in the front here. I want you to move your shoulder blade back towards your spine, keep it in that position, and maintaining a palm up position all the time. And breathe out and come back. And we are going to repeat that 10 times on both sides. Take a deep breath and breathe out and come back. If the shoulder is too painful to move, you can leave the arm part of this movement and you can just place your hand on the bottom rib and you can just focus on rotating the spine and getting that shoulder down the ground without using the arm, because there can be a lot of focus on the painful area in the front of the chest, because that's going to pull a lot and it's going to make you think, well, I don't know what's going on elsewhere in my body. All I'm focusing on is my shoulder, and I don't want you to be able to do that. I want you to focus on what's happening in the thoracic area, that spinal area, which we are trying to mobilize and get it loosened up. So hands on the rib, you can use it almost as a little bit of a handle here and drag yourself down. Get that shoulder blade down onto the ground, hold it there for a few seconds, and then come back. The more you do this, the more freer you'll feel moving your body down to the floor. Then you can feel both shoulders are actually lying on the floor with your hips in this position. And then come back, and then we can repeat that on the other side. And so this brings us to our final exercise. Well, the actual exercise, the other three were just components ahead of this exercise so we can make the best out of this exercise. I don't want you going straight into this exercise cold without having done any of the other movement patterns first. Remember, breathing plays a very important role, and I will make a follow-up video to this one where we actually reset the diaphragm and we get the other components working as well. That actually helps support this movement. So the first thing we need to do is we need to find a wall, and once we get a wall, we are going to orientate ourselves with the wall, and we are going to place our feet approximately 4 to 5 inches from the wall, your heels. Once you've got that position, I want you to bend your knees very, very slightly. Not a lot, just enough to keep them unlocked, because once your knees are unlocked, you've got better control over your pelvis, because that's going to play a part in our next position. So from there, the original wall slide is keeping your bum up against the wall, elbow, wrist, and the back of your head. And then from there, I want you to slide your arms up and down onto the wall, maintaining pressure between your elbows and the wrist and the wall constantly. They are not allowed to lift off the wall at all at any point. That is the original wall slide, and once you get to this position, that is when you know your posture has improved, probably by 80%. All right, but I know there's a lot of you that are not going to get there. I've got patients myself that struggle to even get one elbow on the wall, let alone 2 elbows. So we're going to modify. There are 2 ways we can modify it. The first way we can modify it is you can actually lift your bum away from the wall. That'll give you a little bit better chance to place at least an elbow. If not an elbow and a wrist, at least you'll be able to get an elbow, even if you have to work a little bit harder to push your elbows back. And once you get that position, you can just hold that for 5 to 10 seconds and then relax. And then push into the wall as hard as you can for 5 to 10 seconds and relax, just so that we can get the muscles in the back to contract and the ones in the front to stretch, because that's actually how your body works. Once you've contracted an opposing muscle, the one that's opposite that one actually stretches and opens up, and we want to open up and get these muscles open so that everything else can function in the front as well. So we've got our elbows up. It's the first modification we do with the hips away from the wall, and then from there, if you can touch the palms as well, and once you can keep your arms up against the wall, you can start sliding them up as high as you can without them coming off the wall. Once they start coming off the wall, you know that is your range. You can't go further than that because you're not there yet, and then come back down again. So even though you're working with a small range like that, that's fine, but I don't want them coming off the wall. And then I want you to perform this 10 to 15 times, the movements, or you can hold. If you cannot lift them without bringing your arms away from the wall, I want you to focus on the press and hold for 5 to 10 seconds and relax. Press and hold for 5 to 10 seconds, and you can also do that for 5 to 10 repetitions, holding every time for 5 to 10 seconds. So the second modification, if you cannot get your arms, your elbows, even though you are lifting your hips away from the wall, you still cannot get your arms or your elbows and your wrists to touch, it's too painful, we can turn around, and I want you to stand up against the wall with your toes touching the wall and your nose as close as you can to the wall. Then you're going to place your arms up onto this wall like this. Now you might start feeling a little bit of a pull in the front already, or a little bit of a contraction in the back. And then what I want you to do is I want you to lift your elbows and your palms off the wall like that. Hold for 5 to 10 seconds and relax. Hold for 5 to 10 seconds and relax. Once you can do that, if that is a bit too easy, you can pull and slide the arms up and down and come back down again. Move the arms up and down and come back down again. So it's very similar to the second modification, and you'll probably notice that to do that, you're going to have to lift your chest up. All of these drills that we've done is showing you actually how to lift your chest and come down. How to lift your chest, how to get your pelvis in the right position so that your transverse abdominis and the rest of your core muscles can engage as well while we're doing this, and relax. So all of them are designed to open up the chest, because that's what happens when we get into this poor posture due to either older age, or maybe it's our habits with our cell phones or sitting behind a desk for 20 years. We close everything in and down, developing a lot of conditions. Some of them are chronic conditions as well: asthma, COPD, stress and pain in the neck, poor breathing patterns, poor sleeping patterns, and just overall unhealthy lifestyle. All right, so we want to try and open up everything, get the shoulders nice and open, and create more strength in the back so that we can maintain that posture. And there we go, one wall slide or 3 different wall slides with 3 additional components to build you up towards the perfect wall slide. And just to recap, it's 3 components, 1 exercise with 3 modifications from easy to difficult. If you like this video, please hit the like button, also subscribe and leave a comment down below and tell me how your exercises are going. See you next time.